We're not just posting on Docfluencer MDO, we're organizing. We're building a network of Docfluencers who are tired of being silenced by red tape. We're tired of watching our patients suffer while insurers dictate care. And we're tired of seeing misinformation spread faster than science. And we're ready for systemic change. And I think the American people are too. And so we would love more doctor influencers to join our campaigns and to join our mission and to organize and unify with us as well. I am Dr. Olivia Richman. I'm a family medicine physician and also a doctor influencer, aka Docfluencer. Family medicine goes anywhere from newborns to obstetrics, pregnant patients, all the way into adults and elderly. The bread and butter of chronic conditions, diabetes, hypertension, preventative diseases also, and preventative medicine, those are really the things that we hone in on.
Óyeme, que volá, chicas! It's Olivia here, and I am giving you today's dose of female fact.
I actually started influencing, doing social media back in medical school when I saw a lot of unwanted teen pregnancies and sexual assault cases. And I wanted to bring awareness and speak up around sexual health because sexual health is no less important than every other aspect of your health. And I brought this idea up of starting a YouTube channel around sexual health to my attendings who were like maybe in their 60s and they were men. And they were like, do not do that. You will ruin your career. Like if you talk about sex online. And I was like, I'm going to take the chance because like I can't stand by and not dole out information and education that I know that I'm learning about anatomy and physiology that teenage girls don't have about their bodies. And I just felt compelled to do it. I saw how many Docfluencers had influence on social media, on Instagram and on TikTok, and how many millions of followers they had. And I wanted to create a unified place for everyone to come together as a collective because that didn't exist. I wanted to create and amplify these credible physician voices to shape culture and policy and patient care. And I wanted to just harness that energy for real change within the healthcare system. We all decided that something that impacts all of us as healthcare providers is insurance companies. And, we wanted to highlight the harm of insurer red tape and prior auth delays. Physicians and patients from across the country, even a few international physicians chimed in. And everyone shared very powerful stories. And it reached over 2 million people collectively. And I think we all realize like, this isn't just a physician complaint or a patient complaint. Like this is a systemic crisis. Over 100 Docfluencers from across the country participated in that campaign. It was a no-brainer for all of us. All of us were unified in the decision that we wanted to make this campaign about vaccines. And we wanted to keep it as nonpartisan as we could. We truly want to come from a place that's evidence-based and that is research-backed so that we're just sharing the information and the knowledge that we know. We launched the campaign and we realized that there's a lot of trust that needs to be rebuilt. And we need to be having or be normalizing conversations around vaccines. And we want to combat this misinformation, but in a non-judgmental way. Policy shifts create a lot of confusion for the public. And I see our role as Docfluencers being able to translate what's going on quickly, clearly, and with empathy. I think that by providing the why behind these recommendations is incredibly important and not just the what. We haven't had pushback from other colleagues. I think that, at least not that I know of, like the colleagues that we know are the other Docfluencers online that are spreading and sharing the same information that we are, or, saying it in a different way. I think that people who are associated with institutions, because I have come across a few of those Docfluencers that they don't want to say something, or they're unable to say something because the institution that they work for is concerned about controversy. And I would say that there has been pushback from anti-vaccine groups and people online who strongly disagree with us. The goal really is to respond with questions and curiosity and empathy, because there's a reason that they have that point of view, and they likely have that point of view because that point of view is fear-based. On one side, as a physician, it's like, yes, it's frustrating. Why are people not believing our expertise? And on the other hand, it's like, they have their own reasons, and they're coming from their own point of view of why they do not trust physicians or pharma. And I can definitely have empathy with that. Like, I get it. We have full-time jobs as physicians, and also full-time content creator jobs. Like, is this sustainable? Like, how do we all want to move forward with this as Docfluencers? If we could either make an impact with 20 patients a day, or we can make an impact with 2,000, 20,000, 2 million people a day. And I think that all of our goals, and one of them is a selfish one, which is reducing burnout for ourselves, is the healthier we keep people, the less long-term chronic diseases they could have, right? Some things are going to be inevitable, but other things are not. A lot of conditions are preventable. Such an easy way to get started is sharing stories. People are compelled to listen to stories, and it could be, off the cuff. People don't want perfection. That's not what people are looking for on social media. They want authenticity. And so if you just share one story every other day, once a week, whatever you're able to, I think that one story could impact more people than you know.